old man took his drum and he sang a song. And it's the song of unity. Love.
I was sitting at my desk one morning, shortly after starting a new position, when I received a phone call about a new initiative called the Calgary Zone Indigenous Health Action Plan. The woman on the other end of the line, Penny, seemed excited about the project, and in a short time I started to get excited about it too. I had done similar work in the South Zone, but the Calgary Zone was much bigger and more diverse, with a high population of both rural and urban Indigenous people, including 3 different First Nations communities. I was unsure how we could build meaningful partnerships with such a diversity of people and services.
I was a little nervous because I was one person from a small team. I knew that for us to be successful in improving health outcomes for Indigenous peoples in our zone, we would have to build new partnerships and tread with care. The day I finally sat down face to face with Harley, I was optimistic because we had a shared vision and passion and could see a path forward, despite having no clear blueprint. What we did know is that the process had to be stakeholder-led and built on trust and meaningful conversations. But how could we demonstrate that we were trustworthy, that I was trustworthy? How could we move past political issues and build a collective path forward? How could we balance AHS processes and timelines with those of the community? I was a little anxious, both personally and professionally, because I wanted to make our vision a reality, but I didn't want to overstep, take over, or make an inadvertent insult or slight. Harley assured me that as long as my heart was in the right place, our intentions were good, and we were willing to learn, that we would be okay. Together, we made a commitment to ground the entire process in ceremony and traditional protocols.
A short time later, Penny and I were driving to one of the First Nations health centers. After having done months of internal planning, discussions, and consultation, we had learned that strengthening relationships was a key first step to reestablishing the trust that was lost due to the past restructuring within Alberta Health Services. We weren't sure if or how they wanted to be involved. We had heard the communities were being consulted so much that they were way too busy. We went in the door with an open hand, and we were so pleased with how fast they agreed to work with us. They appreciated that we hadn't come to them with a finished plan for endorsement, but wanted to move forward together.
It was not easy to balance the process that we believed we needed to follow with the internal timelines and pressures. But an elder at one of our discussions turned to us and said, "No one has ever asked us these things before. Thank you for listening." Another said, "No one has treated us with this respect and as equals." It was then that I truly saw how creating space for these conversations to happen was the only path forward, despite it taking more time. As we engaged with more community members, many sacred stories were shared that stayed with me. The young Indigenous social worker who was automatically referred to as a high-risk mother. The elder discharged without shoes at 11 p.m. during a winter storm with no ride to his nation. Another elder who went in for a procedure, a proud and revered community member, and came out 5 days later filled with shame. It was their voices and experiences that drove us forward and helped to create the plan.
The path to meaningful relationships is never straight and narrow, and every new discussion was like walking into unknown territory. Not being able to control timelines and conversations made leadership uneasy at first, but they trusted us to help them navigate the process. And as they began to see the success we were having, some great initiatives started to develop.
National Indigenous Peoples Day celebrations started popping up around the zone.
The Indigenous health team was asked to be more involved in operational planning and emergency management.
Patient Concern started working with us to improve the process for Indigenous families.
And finally, the Indigenous Traditional Protocol Guide was approved for the entire province.
Our large gathering to present the plan to both community and Alberta Health Services leaders was to be held at Blackfoot Crossing, the same place as the signing of Treaty 7. Driving out that morning, so many thoughts were swirling through my mind. What if community members didn't come, or healthcare leaders? Would they see all of their stories and experiences represented in the plan? Would our healthcare leaders agree that our plan was actionable? I will never forget when in the talking circle, one of the urban community members pointed to the screen and said, "You listened to me, and I can see the changes you made for my feedback. My voice is there." It was a beautiful day.
Reflecting on the past 2 years of journeying into the unknown, it was so clear that everyone has a role to play to provide culturally safe care. When we focus on reconnecting with our past, rebuilding our relationships, and becoming true partners, we can
Walk into the future together.